Hello guys, welcome to our channel. Today we'll be looking at the cubital fossa. So what is the cubital fossa? The cubital fossa is a triangular depression and it is located on the anterior part of the elbow joint. So if you take a look at your elbow joint, you'll notice on the anterior part there is a triangular depression. This triangular depression is called the cubital fossa. The cubital fossa is a main pathway for neurovascular structures entering and leaving the hand, like the nerves, the arteries, and the veins. The cubital fossa has three borders. It also has a roof and a floor. The three borders of the cubital fossa are the superior border, the lateral, and the medial border. We'll see all this in an image below. The superior border is formed by an imaginary line between the medial and lateral epicondyles of the humerus. As you can see here, this is the superior border of the cubital fossa formed by an imaginary line between the medial and lateral epicondyles. Then we have the lateral border. The lateral border of the cubital fossa is formed by the medial border of the brachioradialis muscle. This here is the brachioradialis muscle. It forms the lateral border of the cubital fossa. The medial border of the cubital fossa, as we can see here, is formed by the pronator teres muscle. It's formed by the lateral border of the pronator teres muscle. So these three borders are the borders of the cubital fossa: the superior border, the lateral border, and the medial border. These are the borders of the cubital fossa. The roof of the cubital fossa is formed by the bicipital aponeurosis, which is a continuation of the biceps brachii muscles, and also subcutaneous tissue and skin forms the roof of the cubital fossa. The floor of the cubital fossa is formed by the brachialis and supinator muscles. So these are the borders and the roof and the floor of the cubital fossa. And let's take a look at the contents of the cubital fossa. The contents of the cubital fossa are the radial nerve, biceps tendon, brachial artery, and medial nerve. There is a mnemonic here to remember it. From lateral to medial, really need beer to be at my nicest. R, radial, N, nerve. Then B, biceps, T, tendon. B, brachial, A, artery. M, median, N, nerve. This is radial nerve, biceps tendon, brachial artery, and median nerve. You can see it here. This here is the radial nerve, this here is the brachial artery, and this here is the median nerve. This here is the biceps tendon. So from lateral to medial, we have our radial nerve, biceps tendon, brachial artery, and median nerve. Then from medial to lateral, we can use this mnemonic mbbr. M stands for median nerve, B stands for brachial artery, the second B stands for biceps tendon, and R stands for radial nerve. Let's look at some clinical relevance: the brachial pulse and the blood pressure. So the brachial pulse can be felt by palpating immediately medial to the biceps tendon in the cubital fossa. Now, vein puncture. This is done at the median cubital vein. The median cubital vein is located superficially within the roof of the cubital fossa, and this vein connects the basilic and the cephalic vein. Because the median cubital vein can be accessed easily, it makes it a common site for vein puncture. Supracondylar fractures. Now these fractures happen when there is a fall on a hyperextended elbow. This is called supracondylar fractures, as you can see in this X-ray image below. Injury to the musculocutaneous nerve. Now if there is an injury to the musculocutaneous nerve in the cubital fossa, we can have weak flexion and loss of sensory innervation to the lateral part of the forearm. Injury to radial nerve. This is also known as wrist drop. The radial nerve supplies the posterior part of the arm and forearm. So injury to it will cause weakness in the muscles, which will lead to wrist drop. Now, an important note here, the bicipital aponeurosis separates the median cubital vein from the underlying brachial artery and median nerve. So the bicipital aponeurosis helps to protect the brachial artery and median nerve from injury. So we should keep this in mind. So we've come to the end of the study today. Please, if you are just coming new to our channel, try to like and subscribe to our channel. Thank you. We'll be releasing more videos, so please stay tuned.